Now, in light of the Breastfeeding Month and raising awareness on the importance of feeding young ones, we delve into the benefits of breastfeeding, which promotes not only optimal growth and development of the infant, but also reduces the risk of illness and death from common infectious diseases. Are you aware that breastfeeding may have long-term health benefits, such as reducing the risk of obesity and type 2 diabetes? Evidence also indicates that breastfeeding confers benefits to mothers, lowering their risk of breast and ovarian cancer. Today, we ask, is it safe to breastfeed amid COVID-19, a time when even children as young as 2 months old are contracting the deadly virus? And did you know there is a proper and improper way to breastfeed? We'll be discussing this and so much more shortly. Welcome to Frontline. My name is Lincoln Wambogo, and this week we give a special focus to breastfeeding and nutrition, a subject of crucial importance, even more so important amid the coronavirus pandemic. And as Saza Mungo reports, breastfeeding is a cornerstone for a healthy baby and a healthy nation, and it is one of the most effective ways to ensure child survival. However, nearly 2 out of 3 infants are not exclusively breastfed for the recommended 6 months.
Breast milk is the ideal food for infants. It is safe, it is clean, and contains antibodies which help protect against many common childhood illnesses. With the COVID era, a number of lactating mothers are understandably worried and asking themselves whether coronavirus can be passed on through breast milk and what they can do to protect themselves and their babies.
So whether the mother has been diagnosed with the COVID or she has been vaccinated, we should breastfeed our babies.
According to specialists, 99% of mothers in Kenya have embraced breastfeeding despite the myths and misconceptions. But as per WHO, promoting the health of a baby, then breastfeeding is important. But specialists are still on more sensitization as it contributes to a healthy nation. So what exactly makes many young mothers not to breastfeed?
Wasichana wengi wanaona ni kama wakinyonyesha matiti itaanguka. Juu sahi wanataka iwe saa 6 kamili kila wakati, lakini hata usiponyonyesha ama unyonyeshe itakuja kuanguka. Kwa hivyo we nyonyesha mtoto.
All the younger mothers are so busy, they may not have time to even breast milk for the 6 months.
Over the years, breastfeeding has had its fair share of myths and misconceptions, but as specialists advise, breastfeeding should be a norm to both mother and child as it poses benefits for both of them. Reporting for Switch TV, my name is Saza Munga.
We are now joined by Caroline Moller, a public health nutritionist, and Esther Mugusu, the nutrition officer, both working at the Nairobi Metropolitan Services, to share on their expertise on how to properly breastfeed as they share the benefits, the do's and don'ts that come with feeding. Thank you, ladies, for creating time and joining us on this very important discussion. They say breastfeeding can be a challenge. Now, what was the experience for you as a first-time mother breastfeeding your young one?
Well, breastfeeding is a natural process. It does not need to be a challenge.
It does not need to be. Let's start there. It does not need to be a challenge.
Yes, it does not need to be
a challenge. What makes it a challenge then?
What makes it a challenge is when a mother is not told what to do before she delivers her baby. Mm-hmm. And this is to say that the support that this mother needs actually needs to start way back before she goes into the delivery room. Normally, when a mother is given information antenatally, then she will know what to do once she delivers her baby. Mm-hmm. She'll get the knowledge, she'll get the skills, she'll be taught what to do and how to do it. So that once she gets her baby, she can actually even demand to do what she wants with her baby. For example, we say that when a mother delivers her baby, she needs to initiate breastfeeding immediately after delivery. But we find that some hospitals actually take the baby away from the mother and take the baby to the nursery and say that the mother is actually tired and needs to rest. But a mother who knows that she's supposed to initiate breastfeeding immediately will demand that her baby is placed on her abdomen, and while she's cleaned up and sorted out with the rest of the delivery procedures, then she can actually put her baby and start bonding with her baby, and if possible, start breastfeeding immediately.
Thank you, Mr. Caroline. What was the experience for you at first? Did you have this, what did you call it? prenatal?
Yes.
Prenatal information?
Antenatal information.
Thank you, Lincoln. Now, during my time, when I gave birth to my first baby, actually I didn't get that support. During the antenatal, I didn't get any information. So the time I delivered the baby, that is when I did struggle to put the baby on the breast and to breastfeed. So that is where the challenges came in. But with time, I did get support from my mom, from my colleagues, so that I was able to breastfeed the baby.
My director, Tinga, is a man, and soon he'll get a baby. He's asking, what is my role as a man in all this?
So just as Carol has said, we normally want support out there for this mother.
Yes.
And for us, when we are talking about support, her immediate family is actually the immediate support that she needs. And our government has been gracious enough. The Employment Act 2007 actually allows the man to get paternity leave once his wife delivers her baby. So Tinga actually is entitled to 10 days
10
off
days.
duty.
10 days.
Yes, 10 working days. And so that is like 2 weeks,
Yes.
2 numerical weeks. So where he can go out there and support his wife. So normally what happens is that when our men get the paternity leave, unfortunately a lot of times, it is not spent with a wife. It is spent with friends and colleagues and people out there as he celebrates how his wife has gotten a baby. But just to tell the men that this period is for you to support your wife, because she could have undergone some procedures that are a bit that make it painful, okay, to go through the process. She's also simply learning how to take care of the infant, and so she needs support. She needs to rest. She needs lots of help, and above all, bonding with the baby, bonding with the wife, and let him just learn to appreciate that there is this new member of the family who needs to be recognized, who needs to be welcomed home. And one thing that partners also need to learn is that you could help. We have what we call the colic pain, and a lot of times people think it is pain in the stomach because of what the baby has taken. We say that if the technique is not right and the baby takes in a lot of air when they are breastfeeding because of poor latching or what we call poor attachment, then once that wind or the air goes into the baby system and the baby is not burped, when they produce that burping sound, then it is going to create some discomfort. And that is the reason that babies would actually cry at night. So daddy can actually take the baby and put them on their shoulder or put them on their lap and actually talk to them. You know, it's nice to have a deep male voice that is vibrating, and the baby would actually be alert and they would actually listen and recognize his voice. And so it's important for the daddies to actually help.
No, thank you, Esther. Caroline, talking of work and COVID-19, COVID-19 is here with us, and it has impacted the world in numerous ways. Do you think COVID-19 has affected the breastfeeding process for mothers?
Thank you. Now, with this COVID pandemic, we can say there are pros and cons.
We can start with the pros.
Because you find that most of the mothers who have been working are now working from home. And that's an opportunity for the mother to stay with the baby, breastfeed. She's able to even express at her own comfort. So both parents have been involved in parenting their child. So it has been a positive opportunity for them, unlike when they are going out to work. And the other thing is that with the COVID pandemic, when it started from last year, the lockdown came in, restriction of movement. And you find that when we are talking of supporting breastfeeding, we're not only looking at the mothers working in the formal sector. There are those who also work in the informal sectors, either going to the market, those who are doing casual works. And all this, because of all these restrictions, it did affect somehow the family income. If there's a breastfeeding mother in that family, Maybe she was doing, like, if I can refer in Nairobi, those doing casual work. Maybe she does some washing for somebody to earn some income, going to the market. You know, there was restriction. So if we are not even able to get those products, maybe to sell in the market, the way they are being sold initially. So the mother is not able to earn that daily income she depends on to survive. So this definitely hits on the family diet, whereby most families needed to come up with some coping mechanisms, either reducing the number of meals, either skipping meals. And if this is a breastfeeding mother, it will affect her. She's not able to eat those recommended meals. Yes. The other thing is that there was loss of employment. If the breadwinner also lost employment, it will trickle down to this breastfeeding mother, issues of stress coming in. And we know that if the mother is stressed, it will affect the milk flow. So we look at it on both sides. There was the positive aspect and there was the negative aspect. All in all, what we did is encourage mothers to continue breastfeeding their children. And if I can refer, in Nairobi County, we had the WFP, World Food Program, coming in to support these lactating mothers. So we were screening the pregnant and lactating mothers, seeing these mothers who are malnourished, and they were being supported with some stipend. The government did also come in to support these families with some stipend so that they're able to survive. So there were different mechanisms that came in place to ensure that these families are cushioned, because we know a pregnant mother, lactating mothers need optimal nutrition.
Thank you. Thank you so much for the insights. We are taking a short commercial break, but on the other side, we continue this conversation as we show you how to properly feed your baby and how it in turn benefits your health as a mother. We'll leave you with a short story of Holden Muhammad living in Ainabo ID camp as she narrates her challenges as a mother.
هذا محاول حرسي حسوي waxaan ka waxaan adeer waxaan naalay waxaan naalay 6 sano meesh 6 sano oo waxba loo qabanayo oo loo imanayay bisha casna way naqabilsanay marka laba caruur naafisha ayaan lahaa walayda weyn jiray darna way iska leedahay way caafimaadeen naafishkana ma way ka dhamaato way naafishka qaatay.
Thank you so much for staying put. We continue this discussion with Caroline Moller, a public health nutritionist, and Esther Magusu, the nutrition officer, both working at the Nairobi Metropolitan Services. You can see the babies and a breast here. We'll go to that illustration later on. That's going to be the most exciting part about this. Now, Esther, please give insight on some of the benefits that come with breastfeeding.
When you talk about breastfeeding, we have benefits to the baby, benefits to the mother, benefits to the family, and by extension to the nation at large. So when you talk about benefits to the baby, we are looking at first, breast milk is very nutritious. It provides all that the baby needs. It is always ready, it is safe, and it is clean. So it actually provides the immunity that the baby needs, and the baby is not going to have infections, okay, when they're at that young age. So for the mother, there is the bonding, and it also prevents some of the cancers. We have ovarian cancer, we have breast cancer. And by and large, for the family, it's going to reduce health costs, because this child, because of the immune properties in the breast milk, the child is not going to be sick often, and so they're not going to have costs to do with health care. And also in the long run, babies who are exclusively breastfed, they're not going to suffer from chronic illnesses as adults. And earlier, I know we had mentioned diabetes type 2. So these are the kind of diseases that we are avoiding by having the child breastfeed. And breast milk actually contributes to the IQ, to the intelligence of the baby. So the family clearly is going to have a child who is going to be successful. And anybody wants a child who is coming home with who has excelled, not only in the academics, but at least is well developed because of the good nutrition. And so when they are out there, even excelling at academics, excelling at even physical activity and anything else that is intellectual. And so for the nation, what are we looking at? We are looking at more productive workforce, okay? And children who are malnourished will end up as unproductive adults. And we normally say that malnutrition affects the brain of the child. So if the brain is affected, it means then the intellect capacity, the intellectual capacity is actually reduced. Society.
Caroline, are there dangers of using alternative feeding methods when you can breastfeed?
Yes, there are dangers involved with giving artificial feeds. As Esther's mentioned, we've seen breastfeeding has enormous benefits to this baby. Remember, breast milk, as she said, is easily digested. But this artificial milk you're giving to a child is not easily digested. The animal milk, you find that it has more of the protein which form indigestible cards in the baby's digestive system. So it is difficult for a baby to digest this artificial milk. 2, it doesn't have those components that are going to really promote optimal growth and development, because you find the nutrition content of the artificial milk is inferior to breast milk. You can't compare. As much as they try to imitate the breast milk, it is not the same. Take something like the essential fatty acids, which are in breast milk. This is key for brain development, and it's found in no other milk. So you see, if you give your child artificial milk, the child is not getting the essential fatty acids that are key for brain development. So it also contributes to illness. It doesn't have that protective aspect. Breast milk has antibodies that prevent the acute illnesses, the diarrhea, upper respiratory infections, but artificial milk does not have this. So you find that these children tend to get sick more often. The issues of diarrhea, the issues of pneumonia, they are likely to develop other infections like the ear infections known as the otitis media. So this child gets sick more often. Breast milk just does promote child survival, as Esther has said. But now, when you're giving your child artificial milk, they are exposed more to mortality and morbidity. They are 14 more times likely to die compared to a breastfed child.
And that's the worst that can happen.
That's the worst can happen.
Caroline, there are those women who cannot breastfeed due to, some medical complications. How else can they ensure that their babies are properly fed without, having this worst scenario, death?
Now, most mothers are able to breastfeed. Those medical conditions or cases are very minimal, very minimal. Like in cases where a mother is maybe having on epileptic drugs, they may cause some drowsiness. The mother may not be able to breastfeed at that time. If a mother is undergoing chemotherapy, during those sessions, she'll not breastfeed. But most of the conditions, a mother should be able to breastfeed. And if there's these issues of drowsiness, we can recommend expressing of the breast milk, unless it's really contraindicated that the baby should not breastfeed. But if the baby is able to breastfeed, we support the mother to express.
What alternatives do they have?
The artificial milk or the breast milk substitutes, we normally recommend when there's a special case.
When there's a
special case. And that is something you talk or look at individually. It's not something you can bring to public and say, you see, now mothers with this should not breastfeed. You treat the case as an individual.
Now we come to the most exciting part. We have a baby here and we have a breast here. There are proper and improper ways of breastfeeding. There's a lot of myths and misconceptions and myths on breastfeeding. Perhaps we go first with you, Esther. What do you have for us?
So here I have a dummy breast, and I want to discuss how breastfeeding works. So when we look at a breast, I know just like it's human, everybody comes in a different size and shape. So breasts will come in different shapes and sizes. But just to assure you that the inner structure of the breast is actually the same. So within the breast, we have, so probably just to start to say that breast milk production and letdown is controlled by hormones. And these hormones are actually connected to the brain. And so as soon as a mother wants to start breastfeeding, the hormones come into place. So we have a hormone that is called prolactin, and this is the milk producing hormone. And we have another one called oxytocin, and this is the milk letdown hormone. So like we normally, when you're with a breastfeeding woman, she'll actually tell you, I feel like my baby has woken up. So how does she know that her baby has woken up? There's some tingling sensation probably in her breast. It is the action of the oxytocin hormone that is actually telling her it is time to let down that milk, because then her body gets accustomed to a particular pattern in life, and she knows that at this particular time or during this duration, after this period of time, then my baby is normally on the breast. And so the body is simply wired, and it has that tingling sensation. And when that happens, then she knows, oh, she thinks about her baby. So that milk all flows down to around this area. This dark area is the area that we call the areola, okay? And then we have normally a protruding tip, which we call the nipple. So once the milk is made at the back here, it flows down to the areola, where we say we have the larger tubes, which are called the larger ducts. And so the milk that has been produced is going to be accumulated around here. And that is why we tell mothers that when you want your baby to breastfeed properly, you talked about proper and improper breastfeeding. So proper breastfeeding means the baby will open their mouth wide and attach on the areola. If they only attach at the tip of the breast, which is the nipple, at the tip of the nipple, you realize we do not have a lot of the milk here. I say the milk settles around here. So when they breastfeed here, we have mothers getting a lot of complications. They have cracked nipples. They're going to have sore nipples because the baby will suckle and there's nothing that comes out. Because the milk is where? The milk is here. So every mother is able to breastfeed. With a small breast, with a big breast, the structural bit of the tissue, the structural bit of the breast is actually the same. The only difference is the structural tissue. You know, the fat and the tissue, that is the breast tissue, is actually what makes the variation in size. We have mothers who have, probably ladies, you know, with modern life, we want to go for plastic surgery, probably do enlargements. We have insertions, like silicone insertions. So such people sometimes will interfere with the structure of their breasts and may have challenges actually breastfeeding.
Please demonstrate the proper ways to breastfeed.
Okay, thank you. Now, just as Esther has taken us through how breastfeeding works, I'm going to demonstrate on how to properly position and ensure the baby is well attached to the breast. This is my baby. And one key thing is that when you position, ensure that you support your baby's whole body.
Whole body?
Whole body. So you find the head is at the elbow. Then with the same hand, you support the buttocks of the baby. You find mother supporting only the head, which is not right. Now, once you support the whole body, this arm goes behind there. Some mothers breastfeed with the arm here and becomes very, very tricky. So this arm should go behind. You support the whole body. When you do that, you make sure the baby is held close to you, what we call tummy to tummy. Now, when the baby is in this position, you can have a breastfeeding pillow, or you can have a pillow or blanket, just roll it up, put it here to support your arm. So when the baby is supported the whole body, close to you, the baby is in a straight line.
Okay.
The neck is not twisted. Otherwise, when you hold the baby this way, twisting only the neck, it becomes challenging.
Okay.
Now, lastly, as you position, That when you do that, you find that the baby approaches the breast nose to nipple. When the baby approaches the breast nose to nipple, now you need to attach. That breast touches the baby's upper lip. Automatically you expect the baby to open the mouth wide open. Once it's wide open, the lower lip should turn outward. Then the baby is able to latch well to the breast. As the baby does that, the chin will touch the breast. That way your baby is able to suckle effectively. One key thing is the mother supporting the breast. How does she support the breast? You find most of them scissor. Maybe you can demonstrate using that. Most of them scissor, which is not a proper way. Because when you scissor, you're blocking the ducts. Milk is not able to flow properly. So you hold it in a C shape, like that.
Okay.
You place your fingers on the chest, then you hold. And when you're holding in the C shape, you're able to lift the breast in a proper shape, and the baby is able to latch well to the breast. The baby is able to suckle effectively. So the other thing mothers should not do is put your fingers up near to the nipple. That way the baby is not able to hold well on the breast. So you have to move your finger back, put the C shape, and the baby is able to now take the breast well. To show that the oxytocin hormone that Esther talked about is working, you'll find this other breast drips. That shows milk is flowing. It is working well.
It happens naturally.
It happens naturally.
It's a
But when you
miracle.
hear a baby sucking with clicking sounds or smacking sounds, the baby is not latched to the breast properly.
Okay.
When you see a baby suckling, quick rapid sucks, that baby is not suckling well, is not getting adequate milk.
Thank you so much, Caroline Moller, public health nutritionist, and Esther Magusu, a nutrition officer, both from the Nairobi Metropolitan Services, for joining us. And as we come to the end of the show, we'll leave you with a short clip of how expectant mothers in Somaliland overcome numerous threats in their journey towards motherhood. My name is Lincoln Ambogo, and this is Frontline. Till next week, same time, stay safe.
In an area characterized by droughts, food insecurity, morbidity and lack of proper health care, expectant mothers are often negatively exposed to threats that could hinder them from carrying their pregnancies to maturity. Through their humanitarian efforts, SRCS and International Federation of Red Cross and Red Crescent Movement offers support to expectant mothers through physical and mobile clinics across Somaliland. The clinics offer full prenatal care for expectant mothers and postnatal care after safe deliveries.
So,